Hey everyone, it's Rob, and welcome to Leading with Genuine Care Pod. I'm so grateful for your time today. And our special guest, Anant Kumar, who is the founder and CEO of Life Circle Health Services in India. Life Circle provides subscription-based professional caregiving and home nursing services to chronically ill and bedridden seniors in India. Before Life Circle, he was the founder and CEO of Life Spring maternity hospital chain in India. Under his leadership, Life Spring was awarded the UN World Business and Development Award and also received the Frost and Sullivan Award for being the Mother and Child Healthcare Provider of the Year in India. He is currently the member of Confederation of Indian Industry Senior Care Task Force. He has served on Merck's Expert Forum of Maternal Mortality, supported by the World Health Organization, and served on the U.S. Agency for International Development Market-Based Partnerships for Health. USAID's work, by the way, advances U.S. national security and economic prosperity, demonstrates American generosity, and promotes a path to recipient self-reliance and resilience. He also serves on the EU-funded Committee for Strengthening Human Resources for Health in India. Anant is a TED India Fellow and also the winner of the Entrepreneur of the Year Award by the Economic Times, now TV, and a runner-up for the Social Entrepreneur of the Year in 2010, organized by the Schwab Foundation in partnership with the World Economic Forum. So you are not going to want to miss our conversation. So I hope you enjoy it. We discuss what exactly a social entrepreneur is and what a social enterprise is and how it can make a difference in the world at a grassroots level. We also discuss social equality. Please listen carefully to Anant's wise words on this subject. So without further ado, please enjoy my chat with Anant Kumar. Anant, thank you for joining today. How are you?
I'm very well. Thank you for asking. I hope you also have a good morning today.
Thank you very much. It's a good morning so far and a good evening to you from Hyderabad, India, where it's probably somewhere around, 5:30 p.m., where it's a little after 8 a.m. here in America on the east side?
Yes, you're right. So it's 5:30 p.m. now.
Yeah.
And we are just wrapping up our work for the day.
And I had asked you before we got started how my day was going to be, since you've already had a full one. You said it's always going to be a good day. So I appreciate that. And we were talking a little bit about the city that you're in. It's 8 to 10 million people, and maybe just share a little bit about where you're at and what it's like.
Yeah. So currently I'm based in Hyderabad, and it's on the southern part of India, and it's a fast growing city. So, and with a very history, it has a long history behind, and there was a time when Hyderabad was called the Paris of the East, right? Because it had so much of history and so much of trade on commerce going on. You might be interested in knowing that this city was also called the City of Pearls. You still have some of the best pearls in the world available in Hyderabad. And moreover, world largest diamond, it's called Kohinoor, right? And now it is with the Queen of England, and now with the British government. In fact, that was mined near to Hyderabad. So it also has like a rich history. But now Hyderabad is more known for technology, right? Software development. Some of the largest US companies like Microsoft, Google, they have offices in Hyderabad. And many of the works are conducted from Hyderabad. So that's what Hyderabad is about. Yeah.
Great. And, I wanted to touch today on your background, and it's a good segue when you talk about some of the companies that are there, some of the technology companies. And it gets me thinking a little bit about business and entrepreneurship. And that, of course, comes around to some of your experience. And, you're really a social entrepreneur. And in doing some of the research that we've done, we learned that you have a certificate in social entrepreneurship from INSEAD, if I said that right. And that's considered the business school of the world. And can you explain what INSEAD is and what did you learn about social entrepreneurship, and how you're applying it to your business?
Before speaking about INSEAD, I also want to talk about a bit about entrepreneurship and social entrepreneurship in detail.
Great.
And if you look at, there are challenges, there are some social challenges that we face. It could be lead to environment, it could be lead to income disparity, and many more. And traditionally, the solution is either with the government, right, or with not-for-profit, right, or NGOs, what we call it. But there's a new type of business. I would not say new. This is now more than 20 years that the social entrepreneurship is in place, where business models are applied or business ideas are applied, but the primary objective is not return on the capital or equity, but on a social equity. So the social objective takes a precedent over the capital, this thing. But the principles that are applied are all of business, this thing. So, and that's what the course, INSEAD course, that is a French business school, which has campus in outside Paris and also in Singapore. So I did this course in Singapore way back around 10 years back, where we were grounded on models or the framework that can be used, right, to solve some of the trickiest problem or problems that a traditional not-for-profit cannot solve using models or principles that are applied in a pure business model. And I have been doing that. In fact, I have been practicing some of these ideas for last 15 years since I started my my different enterprises that I have built over a period of time. So way back in 2004, 2005, I founded a chain of maternity hospitals, right, for working poor. And now I am running a enterprise which provides affordable care to seniors, right? And this care is provided by school dropouts or women who have very limited work options. So very different kind of opportunities, and I can talk in detail about it as we go. But using some of the principles that I learned in a social enterprise course, and from there I build the business.
Yeah. So let me first ask on the social entrepreneurship side of things. It is a for-profit organization. Right. When you enter into this, it's just your ideals, or maybe is it even your end result or end game is different? Am I following that properly?
Yes, you are right. That although it is a for-profit model, but the end gain is a social good. And the basic reason why it is done is that when you think of a charity, right? You look at the recipient of that charity as somebody to whom you are doing in a way a favor, or you're doing something good to that person, right? So you create a kind of a level. You are giving and somebody's taking that. Maybe so you're a donor and there's a recipient, right? So you're not on the same level, right? And the moment you are not on the same level, you create a kind of a gap. So in terms of accountability, right? You have, because I'm doing you a favor, right? I'm giving you a free water or a free job, right? or I'm giving you a free training, or I'm giving you a free medical service, right? What am I doing? I'm doing you a favor. When I'm doing you a favor, you don't ask for, beyond a point, an accountability, right? You say, okay. On the other hand, in a private enterprise, right? Even if you go and buy a coffee, right? And you pay a couple of dollars for that, you want the best coffee, right? For that price, right? You don't say that, okay, just because I'm paying a lower price for that coffee, I'm happy with drinking a bad coffee, right? Or so a private enterprise in a social model creates equal. You look at your people that you are as a recipient of a charity, but as your clients, right? So you are, both of you are at an equal level. You look at them as clients. You build systems, or you build quality system where you know that if you do not provide a good care or good service, the client is going to reject you. He'll go to somebody else to this thing. Uh, Many of the enterprises, social enterprises, or even if you look at the charities, sometimes miss this very important vital point, and then they fail. So it comes from an idea that I'm doing good, right? If I'm doing good, I should have enough customers coming to my doorstep, right? If I am providing a free medical care, I should have a lot of people, poor people, coming to my hospital or a clinic to take the service. But if I am not doing that with a quality, right, and quality from the eyes of the customer, the person who is going to take the service, they're not going to come back to you, right? Just because we are doing it free or we are doing it at a low price doesn't mean that they would come to you. It has to be something that they value, right? And value can only come if there's a quality, right? So that's the very important difference, that being in a social enterprise, I feel that it's very important that the model should be built keeping in mind a private model where you look at the person for whom you're creating a model as a client, not as a recipient of a charity, right?
So help me understand. So here in America, for example, a trend got started, and I feel like it was a pretty good trend, and still continues on. There was a company called Tom's Shoes, and for every pair of shoes they sold, they would give a pair away to someone in the world, or different places in the world, and then other similar types of organizations started doing similar things with different types of products. Do you distinguish that differently because they are giving something away after a sale?
Yes, in a way, if you look at it, and I have used Tom Shoes, it was there. And one of the things that we have to understand is, are we giving a choice? So when I'm giving shoes to somebody, right, I'm giving a choice to the person who's paying, right? I can take a different color or a different design. But what is the choice that we are offering to the person recipient, right? Did I ask that person, do you want a fancy shoe, right? They're different, right? So I made, just because I am poor, you are giving me a pair of shoes, which is nice. But what choice do I have? Can I select a better? I like to run. So can I get a running shoe, right? Or I work in a mine, or I work in agriculture, right? And I need something which can cover my legs, right? So what is the choice that I have? I would have rather preferred that they reverse the model, right? And say, okay, they sell shoes to them, right? Find a price point that is best suited for this thing. Give them choice, give them offering. Uh, at the moment I do free, right, it also builds a culture. So it's not about Tom, the private side, but the Tom, the charitable side, Tom Shoes, right? Where the people who are working there, we also have to think what is going on in their mind. How are they interacting with the people to whom they are offering these free shoes, right? Are they treating them nicely, right? Are they offering them choice, or are they just taking, say, a truckload of shoes to a village and saying, okay, please choose whatever you can? I don't know. So, but
Right.
that becomes important, right? When we are working with the with the poor, or some we are trying to address a problem, right? I'm assuming the problem that Tom Seuss is trying to address is that access to, footwear, right? Because there, and the footwear can have multiple uses, right? Right. And people would have choice. I think it's important. uh, and I'm using multiple terms. I'm sorry, we are having a conversation and sometimes I get animated.
Yeah, no, you're
Because,
okay.
yeah. So it's important that we provide a choice to the end user, right? That end user can be the poorest person, but if I'm working with that end user and I'm trying to do something good, and I put this in quotes, good, right? Because what I may feel is good might not be good for that person, right, or maybe that person doesn't value that as a good thing, right? He or she may think that, okay, I already have two pair of shoes, I get one more, let me take, anyway it's free, I should just get it, right, and keep it with me. So I think that part is equally important, because and that's where the price comes, because the moment you add a price, right, you make yourself accountable, right? So if Toms were selling those shoes at a price, right, and creating a kind of, then the user can demand, right? A poor kid can demand, no, I want a better sole, right? I
Yeah.
don't like this color is dated, I want the latest design, right? And we have to do it. We have to meet that requirement, right?
Yeah. Yeah.
Because it's not only about giving something, right? A human being is not only about, okay, you're not covering the legs, right, or the foot. You're also creating the dignity for that person, right? How he or she feels about it when he's going out, right, for a social occasion or something else, right? So that's what how
Yeah,
I think.
I love the way you framed that when we had a pre-call before and you'd mentioned that, and I want to kind of segue into some of your experience where you recognized a need in the marketplace for an affordable and safe and dignified maternity hospital in India, and so you started LifeSpring, and originally when we spoke, I didn't realize that it was a social entrepreneurship or enterprise. I thought it was a nonprofit. So you gave me a lot of great insight in that, and how it sort of the business model of it works. So can you share a little bit about that?
Yeah, sure, I can. So in fact, before starting, I didn't talk a bit, about my career, but I have a very interesting career, before starting. So before starting maternity hospital, LifeSpring Hospital, I was marketing contraceptives for a contraceptive company. And from there, I moved to a maternity hospital. And I'm not a medical doctor. So there was a lot of things that, okay, you are come from a totally different business line or idea, right? And so did you not work, did the previous enterprise didn't work well for you? In a way, yes, but I think there is a history to that. And that's important because that builds into the enterprise idea that I worked on. So as a part of my contraceptive marketing, I had to visit many of these hospitals, government hospitals primarily, to train doctors on contraceptive dispensing and things like that. And during those visits, I happened to, witness the condition of the government hospitals in India, which are mostly overcrowded, and there are not enough beds. There's not enough privacy that is there for women, especially from the poor background, to, to access care. On the other hand, if you look at the private hospitals in India, they're quite good. They can be compared with some of the European or American hospitals, but they are beyond reach of the poor, right? Indian poor. And that's where this idea came that, is there a possibility to create a kind of a hospital, right, which can provide the quality of care that a private hospital enterprise or a chain in India provides, but focus at a working poor. So, or for poor who can, who earn less than $1 a day or even less. So that was the model that I worked on, right? Where we try to create a chain of maternity hospitals which can provide affordable quality care, right, to working poor in the urban slums of India. And in a way, it was a very challenging ask or a task, I should say, given that there was no similar model in India or outside. Moreover, I was not a doctor, medical doctor, right? I was an outsider. I was a management graduate whose experience till that point of time was only marketing contraceptives, right? So it was quite a challenging task. But the advantage that I had was that I was an outsider, so I didn't have any bias about what works or what doesn't work, right? I only had this idea that we should be able to provide affordable care to working poor, right? And still remain profitable, because that's where my basic philosophy comes from, which I described to you earlier. That if we run in a charitable manner, right? We run as a charity, we create that difference, right? We create hierarchy where your client or the user of your services or product has a lower position than you, or it's not only about me, but the entire team, right? So I wanted it to be a profitable model, and charge for the services. And we started, and you'd be amazed to know that when we started our service, we used to charge around $20 for a delivery, right? And still remain profitable, right? So it was like, it was, you could just imagine, we were comparing with the US prices, and it was like 600 or 700 US dollar at that point of time. I do not know what is the price now, but whereas we were able to provide the same service for $20 to $30, right? And what we did was very simple things, right? We didn't we worked on some of the basic management tools that are available in other industries, right? Which is like, how do you improve the or utilize the fixed cost? So if you look at low cost airline, the way they operate is very similar to what a hospital can operate, and we did that. So most of the cost in a hospital is a fixed cost, right? You have to pay the salaries, wages, rentals, right? Irrespective of number of patients that you have in a hospital, right? Very similar to a low cost airline or budget airline, where irrespective of number of flyers, you have to pay the cost of fuel, or the pilot, or the staff that is there. So what we did was, we priced in such a manner where we can get more and more people, right, to come into our hospital at a price. So we used to do 6 to 7 times more birth in the same facility that a big private hospital used to do. So in a way, we were utilizing our infrastructure 7 times more than another hospital. The moment we did that, the price of additional price of providing the service came down drastically for us. So this is just one example that we tried, and it worked for us. We built one hospital, and that hospital did well, and we were able to add 11 more hospitals after that. We were able to raise some impact investment fund also, and scale up that model to many more places.
Mm-hmm. And then similarly, when you were getting ready to start LifeSpring, and you recognized this need in the market and this unique way to bring the service to those who needed it, you recognized another need in the market, but on the other side of things, on senior services.
Yeah, so senior services was a personal journey that I had. So as I mentioned to you, that I stay in Hyderabad, and my parents, in fact, my mother and father, they used to stay in Delhi, which is the capital of India.
Yeah.
And my mother had to undergo a knee replacement surgery, right? And post that surgery, she needed someone, a nurse or a caregiver, to take care of her at home. And despite being in the capital of India, right, we were not able to find one qualified person, right, who can come and stay with my mother. Uh, and you can understand that I was in a healthcare space. I was running a hospital, and I was not able to find one nurse, right, who can come and stay and take care of my mom for a couple of months till the time she was, she had recovered fully. Uh, and that task fell on my relatives. In fact, my sister-in-laws, my brother's family, we are a joint family, so they were there, and they were lawyers, Supreme Court lawyer, and they had to leave their practice, right, and take care of my mom for 2 months. And that gave me the thought that, one is that how frustrating it is, right? One is that my sister-in-laws are not trained to take care of a senior because they're as a family caregiver, right? Second is that despite running a hospital chain, being in healthcare space in India, I'm not able to find one nurse who can take care of seniors at home. And the more I thought about it and talked to people, everybody said it's the same problem. Everybody is facing the same problem. And in a way, we were the first generation, right? So if you look at life expectancy in India, it has been, we are in a way, we are in 40s now. We are the first generation of Indians uh, who are taking care, where the parents are living that long, 80 years, 90 years, 70 years.
Mm-hmm.
My grandfather, lived up to 70, and my great grandfather lived up to 35 or 40 years. That's what I know.
Mm-hmm.
So they never had that experience. We had never seen our parents or grandparents taking care of elders at home because they didn't live that long. So there was one that because of improvement in health conditions, we were living longer, right? The challenge also was that in India, you had this traditional joint family system, which was also breaking. Like, as you can see, I am working in Hyderabad. My parents are in Delhi. People are moving to different cities, right? Uh, in India, like many countries, there are more women who were the primary uh, uh, caregivers are also now into the workforce, right?
Yeah.
So it is like there are multiple challenges, right? And that I saw. So it was not only taking care of the seniors, but it was also trying to help my sister-in-laws to continue with their practice, right? Or do something meaningful with their life. Try to find a good career of good quality of care for my parents. So all this combination of factors made me start uh, an enterprise, right, to take care of seniors in India. So what we do is we provide home care services, professional caregiving, and nursing care for seniors. What we also do is we also train to take care of the seniors. We train school dropouts, mostly women from rural India, right, and connect them to seniors, right, to take care of different kind of health issues. So it's in a way what we are doing is 70% of what we earn today goes back to these women who in a way remit back to the villages that they come from. So it's in a way it's a dual impact that we see, which gets created not only for the seniors but for all these young women and men who work with us as caregivers and nurses.
And it's Life Circle is the name
Life
of it.
Circle,
Yeah.
yes.
Yeah. And correct me if I don't have this exactly right, but did you receive a grant or some funding, or you have a partnership with an organization called Group SOS out of Paris?
Yes, you are right.
And they're
So
a social entrepreneurship. They support this sort of thing.
yes, absolutely. So it is a French social enterprise. It's called Group SOS, and they are one of the largest social enterprise in France. The last I heard, they had some 12,000 employees in France, right? And interestingly, it was started by a nightclub manager, right? So he used to work in a, and he's still the president of the Group SOS. And he started with a very simple problem of de-addiction. So he was a nightclub manager, and he used to see a lot of this addiction problem, drug addiction problem, and he wanted to. Uh, so in the night, he used to work as a manager for this club, but daytime he started a de-addiction center for some of his clients, and from there, in 30, so very inspiring story, and from de-addiction he went to building employment opportunity and things like that, and one thing took to another thing, and so they are our partners. They'll run the home care facility in France, Paris, and many other cities.
Mm-hmm.
And they have opened their protocols to us, guidelines to us. We have sent our people to Paris to get trained on some of those guidelines. Their people have come to India and worked with us on ground uh, to, so some of those things we were able to learn, some of the best practices that is already there, we learned from Group SOS France.
I read in 2010, I believe, you were part of a roundtable of entrepreneurs with innovative models in Mumbai, and you visited with then U.S. President Barack Obama.
Yes.
What was that experience like for you?
Yeah, so I think that's the moment that I cherish. I haven't met the president of India till now, but I have met the president of United States, and a president that I really like for the approach that he had and on issues that he took up. So uh, there was a team of entrepreneurs, social entrepreneurs, who were invited for a, a very closed door meeting with President Obama. And the point was, can some of those models, social ideas that are working in India, can be taken back to US, right? So that was one of the thoughts that we had. And interestingly, we were thinking of setting up a LifeSpring hospital in New York, right? So we moved to a large extent to find a way to, can this model work in United States, right? Where there are a lot of poor people who can benefit from such services. But somehow it didn't take off. But that was one of the ideas that we had discussed, right, or suggested, and it also gave me an insight about President Obama, who was like, realized that he puts you in comfort, right? So he was like, you don't get the kind of this thing here that you sometimes you get when you meet the president of a country, right?
Mm-hmm.
So it was really a memorable. I'm glad that you found out that I had not written anywhere in my profile or LinkedIn. I generally don't mention that, but I think your research team must have done a great job of.
Well, it's an amazing experience, and now with that, and so maybe some additional inspiration that goes along with it. Not that you need it anymore. One of the purposes of leading with genuine care is how can we lead together through these very challenging times, now more than ever, with obviously the global pandemic, with COVID. And I'm just curious what your thoughts are on the type of leadership that needs to take place, as we, and we're still ways away, but as we come out of this situation as a society, what should our leadership look like?
Yeah, so I think with COVID, and I should say even without COVID, the global leadership today is going through a very difficult time. The world is going through a difficult time primarily because of the leaders that we have today. And I think one of the important thing is for leaders, whether a small company that I run or a provincial administrator or the president of the United States, is to have empathy, or able to feel what people are going through, right? It's not a normal time, right? And we have to provide that space to our people or people that we are leading. So if I'm working with a set of caregivers or managers, I cannot enforce the same set of rules or regulations that was there, say, pre-COVID time, right? There's a lot of uncertainty, there's a lot of mental stress that people are going through, and that we come across. Uh, so that's one. So we have to reset our expectations from people. Second is also what we are communicating to the people, right? And that's another important thing that we have to I think many people are worried about uh, how this is going to end, right? How this COVID is going to end. Uh, and I think what we need to understand is that, uh, and that's what our leaders have to, it's about the moment we think about it as an end to this, right? There will be something new would come up. Maybe a depression, economic depression might come up. Maybe a cyclone might come up in one part of the world, which might be more devastating than COVID. Maybe now COVID is all over the world, but there are smaller problems. Maybe a person who, because of this COVID, has lost his or her job. For her, she's not thinking about COVID, but she's thinking about how do I pay the rent, right, at the end of the day. So we have to break down that problem. I think COVID is only the manifestation, right, according to me. But I think the problem is much more, simpler, or in a way which the leaders can address, providing job to people, right? Uh, Relaxing the regulations that are there. Like, for example, in a company like mine, uh, generally offices have 9 to 5 hours. Now we have relaxed that. So it really doesn't matter whether you come by 9 or you come by 10, right? Or today, if you are not feeling safe, you can work from home, right? We cannot force them and say that, okay, now, right? Because the most important thing is the life and the safety of the employee and the work and the person. So in a similar manner, I think the leaders have to say that this is going to be a journey, right? We should not get worried about kind of an end. Okay, so we would get a vaccine and that would be the end of the problem. We don't know when the vaccine would come, whether the vaccine would work, right? If it works, will there be a new strain of COVID 2021 come up? We don't know, right? So why to be worried about that? Let us live with it, right? Live with it. Let us protect ourselves. Let us be careful. But let us go back to something which is very important, especially for people who are poor, people who are more. There's a quote which keeps on going. I was talking to someone and he asked me, "How are you?" And I said, "Okay, we are all in the same boat." And he said, "Probably we are all in the same boat, but some people are in a boat which are very different, right? The storm is right. The storm is different for different people, right? So for a poor factory worker who has lost the job, the boat is very different from a boat of a social entrepreneur like me, right? Uh, so that's what has to be there. The leaders have to think about those specific problems, challenges, and take it on COVID on a parallel track, right? And not look at it as to be the only problem, right? So, as I gave an example of a cyclone or a flood, right? So if a part of the country is flooded, like in India, for that set of people, flood is a bigger problem than COVID at that point of time.
Right. So as we move towards wrapping, I have one last question for you. What are your thoughts on how we can create a more equitable society as a whole in this entire world, on this strange rock we live on, as I like to say?
Yeah. So so it's a definitely a strange rock that we are on, and creating a equitable society is, I would say, come from being connected, right? Where we are able to understand, right? So the first thing is that we should be able to understand the problems of other, concerns of other, happiness of others, what makes other people happy, what makes. So it is not only about having a kind of income distribution or bringing that, but there are non-income gaps, right? And how do you feel that? And one of the ways that communicating, right? Able to understand the other's perspective, right? Uh, for example, in the US, and I follow a bit between, what the Republicans are saying or the Democrats are saying. Now I understand that, people don't see an eye to eye. And in India also, we have things like that. Or so if we don't understand the other side, the other individual, where that person is coming from, we are not able to build that communication. So we have so many communication channels like Facebook, Twitter, Instagram, WhatsApp, but we have stopped understanding each other, right? Uh, it has become like a Tower of Babel, I think, where, right, we are all speaking, but nobody is listening. So I think it starts with able to listen and understand others' perspective. How do you do that is a problem, is a $1 million question, but I think that's one. Simple ideas like, what I feel is that if people can meet, see face to face, it can be a Zoom call or it can be a local, if a COVID permits, right? If you look at it long term, right? COVID may go in a year or two. How do we get people from different religion to come and sit if there's a religion, this thing? Or income gaps, right? So somebody is a startup founder with $1 million exit, sitting with another person who's a homeless, right? Till the time they don't sit with each other, right, to understand what the other person is facing, I don't see a solution. But if those small things, and it can be done, we are not talking about even one person is able to build a bridge with another person with a different view, right? By just speaking out, or at least saying, yes, I understand what you say. I may agree or don't agree, but at least I understand your views. Versus a point where, right, we have stopped listening and, talking. Yeah. So I think that's that. I look at equity beyond the income disparity, right? Because income, even if you make income, everybody's income equal, I believe that people will still not be happy. Right. Because it's something in the mind, right? So, so like some of the poorest country, like there's a country, Bhutan, which is one of the happiest country in the world, right?
Yes.
Probably if you look at the GDP, they might be in the bottom somewhere, but they're happy, right?
Yeah.
So that comes from the contentment, from a communication, from that feeling of community, kinship, right?
Yes.
So that's my take on that.
It's a really wise take, and I appreciate those words, especially that we are all speaking, but no one's taking time to listen, and those are very well said words. And Anant, I want to thank you so much for taking the time to chat with me today, to bring this conversation about leading with genuine care to the forefront. And to all the listeners, I greatly appreciate you spending time with us today. And as always, I wish you all much love and gratitude.
Thank you, Rob, for having me here.
Thank you
And
so
it was
much.
a real pleasure speaking with you.
Thank you so much.